Okay, so I'm also a teacher in the university in vet school. I'm teaching radiology, so now I'm also like teaching you. Even I have a little less teaching experience, just like 15 years, but I'm so old. But I have done my thesis about like these vertebral anomalies and this intervertebral disease. I'm just waiting for my public defense to have time for that, but it's practically ready. Just defense still left, and so this is subject that I have been working on several years now, with Skye Terriers. So this is what I have. I have this sisältö in Finnish, but the content of this lecture. So I've just shown the normal intervertebral disc, and then the degeneration of the discs, and about the disease, and then some images, and then something about the clinical relevance of this disease and the findings, and then I tell you about the radiographic screening. You can call it IVDD screening or IDC screening if you mean a disease or calcifications, and what can we do with imaging, and especially radiographs, and what's the grading scale, and what's the relevance of these findings, and something about the grading. So the normal intervertebral discs, as you see, it's like they are located between the vertebra, and they begin from the second cervical vertebra, and also they are found between the tail vertebrae, and it's like this elastic structure that has this like a pillow, this like a very like a moist pillow structure, this nucleus inside, and the fibrous annulus around it, and it transmits forces and absorbs them when it's normal. And we don't see it in radiographs when it's normal, so it's radiolucent. So in these spaces we don't see anything because there is a normal, supposed to be normal intervertebral discs between. And then when the degeneration begins, it begins with all of us. So our spines and this degenerate. But with these chondrodystrophic breeds, this degeneration begins at the embryonic phase already and very young, and then it causes problems early. So this is the early intervertebral disc disease that we are like trying to resist this with this screening, because it happens to all of us when we go old, but we don't want it to happen too soon. And this is the most common spinal disease in dogs, neurological disease, and that's why very big problem. And reported mortality is quite high with the symptomatic dogs. So the Dachshund, what breed that has been studied most, there was a Danish study that the mortality was as high as 33% for this disease, but they didn't die for the instance like a herniation, but for the disease in a longer period of time. So, but still, as I have been working on this subject, we can see that there are differences between different chondrodystrophic breeds. So not all breeds that have this gene got the same results. Not all have the same calcifications. For example, now it's interesting that the COVID breeds, Cardigans and Pembrokes, they are different. Cardigans have much more calcified discs than Pembroke, and we are trying to do some study about that. So there are differences, so but we don't know everything about this yet. But this gene, of course, this CDDU gene, this retrogene in chromosome 12 is a major gene about this. What happens with this degeneration, this early degeneration with the chondrodystrophic dogs? The normal gel-like nucleus, which is this trait that I have been like appearance that is moist, then it dehydrates and looks like amazing, and then most often with these dogs calcificates and is hard after that. And this, when it degenerates, it's like then doesn't tolerate the normal forces anymore. And here is images from the pathology about the normal and the degenerated discs. And as you know, that this structure it's like squeezed together, and the end plates are reacting, and we don't see the normal nucleus anymore. It's bulging here, and because the annulus, that is the fibrous tissue around the nucleus, it's thinner up here, and here goes the spinal cord. Then when it extrudes, it goes towards the spinal cord. Usually not it doesn't like extrude to the lower part. So when it's stiff and it has more in the degeneration, it usually has already some crackles in it, and then it tears more easily with the normal forces. And here we can see some calcified IVDs in the spine, and here is some CT, computer tomography images. And in this computer tomography, when we don't have the summation of these ribs and other structures, we can see that the calcified material is here in the area of the spinal cord, or also in this IVD space above it. So when it extrudes and hits the spinal cord, it causes like a damage that is a combination of pressure. It presses the spinal cord, and then also the impact damage. Some breeds have also hemorrhage, and which is also pressing the spinal cord. Most clinical signs, they are acute. They begin quite suddenly, but there are also symptoms that the dog might be in pain that we don't see it so like quickly. We can suspect that there is something that it can be like the dog is not, it's like irritated more easily, or it withdraws, or doesn't want to move, or doesn't want to jump, or the back may be like an abnormal position, but the pain is not so easily always evaluated with the dog. But if there is acute extrusion, then it usually has some neurological signs in addition to pain. So it usually has paralysis in hand limbs, might be in one or both, or it might be that it cannot turn the leg normally. If the paw is left like this when you turn it, or if it's like totally paralyzed, it might have lost it in deep pain perception, which is like when we are pushing the bones in the toes, and it doesn't feel this pressure anymore, and it doesn't take the leg away when you press it. Then the prognosis is usually poorer, so the treatment can be conservative or surgical, but when the deep pain perception is lost, then it's also always surgical treatment. And the prognosis, I think it's not very poor always, but if you do the surgery quickly, but it's not so good as if the deep pain perception would be left. Then about the radiographic screening. So here are the images what we take when we are screening. So we take the images of the cervical spine, and it's very important in the images that we can see the intervertebral spaces without summation. So that's why we are quite picky with the images. We don't want them to be rotated so that we don't see these spaces. And that's why we also need the space between the cervical and thoracic spine. So these junction images, so that we can see as well as we can. Here we can see some totally calcified IVDs, and then we take the thoracic spine as a whole, and it's the radiographic technique that when we take this big area, we don't see this area which is on the side straight. So that's why we need also the other image of this junction from the thoracic and lumbar spine. Here is again calcified IVDs. Here we can suspect, but we need another image. And here we can see there is calcified discs. And then we take the lumbar spine also. Here is again, and these are the images that we need for the evaluation. And then we count every calcified IVDs. It's possible. I think this dog also has some small in the tail, but we don't count them from the caudally to the sacrum. So we count them from the second cervical vertebra to the sacrum. And there is the amount of calcifications then with the dog. And when these discs are degenerated and calcified, then we usually see them in the radiographs. And we were studying about the young adult junctions, which were asymptomatic, and we could prove with them that these CDVR, that are the calcified discs that we can see in the radiographs, they can be used as an indicator of the disc degeneration that we can see with the MRI images of the dog. So, and it also resembles the histological state of the dog that way that the MRI correlates with the histology. If we do it with the computer tomography, we could see much more, very tiny calcifications, but I don't think that's the method for a breeding dog, not for the screening, to image with the computer tomography the whole spine, because the radiation dose is quite big when you image the healthy dog from almost from the tip of the nose to the tail. So I wouldn't do that, and because it doesn't correlate totally with the radiographs. So we would have to build another system to see it, and it would be a lot of work, and I wouldn't do it, and because the radiographs actually correlate more with the MRI than the CT. The MRI is used for the clinical evaluation because we can see the spinal cord and the nerves and the vessels, and we can see also the healthy IVDs and the old stages of the degeneration. So that's the modality for clinical diagnosis. And here is some MRI images of the normal disc. But here is the normal intervertebral disc. In these images it's white because it has it's hydrated, and then here is the spinal cord and the cerebral spinal fluid around it, and this is the transverse image, and then here is the sagittal image, and here is the spinal cord, and here are the IVDs, the normal white ones that we see in these T2 weighted images. And here is the vertebra. And then, I don't know if you see so well from these images, but here we can say, at least you can see in these MRI images, that you don't see these white discs here anymore. This dog has severely degenerated discs and some moderately degenerated discs. It has some black spots here, so resembling the degeneration, and here we can see that the calcification, here is some summation, but here we can see that the same IVD is here calcified, and also some little calcification there. And the grading scale that we use, it used the same scale in many countries, in all Nordic countries, and now we are also negotiating with Germany because they want to use the same scale and the same system, and maybe we have some common panel in the future also. And the grade is given like, it doesn't have any calcified discs, it gets grade 0, and if it has 1 to 2, it gets grade 1, so mild calcification. If it has 3 to 4, it gets grade 2, and if it has at least 5 calcified discs, it has grade 3. So it 3 severe calcification.
Yeah, what is the minimum age for your whatever methods?
It's 2 years. It's the minimum age for this, and it's based on mainly on the studies with the dachshunds. That because we want to, of course, evaluate the early degeneration. So it's not used if it's very old dog, because it doesn't resemble so well the early degeneration. But if it's too young, we don't see all the calcifications so well.
So it's the same for all methods?
For this IVD grading, yeah.
Yeah, okay.
It's 2 years.
In Denmark, they need to be graded between 2 and 4 years old.
Yeah.
That's what they require for a pedigree.
Yeah, and that's based on the dachshund studies, because if the dog has at least like a 4, especially those that have like a grade 3, they have more of this dilution of this calcification because some inflammatory reactions, or and then that's why the amount of the calcification may decrease within the age. But of course it can be that they get new ones in other places, but it's not so sure with the older animals. But we don't have that age limit, because I think the dog has to be like, because the old dogs are good for like breeding dogs. The value of the old healthy dogs is I think big for the breeding, and if it would be like a healthy 8 years old dog and it cannot get this evaluation, it cannot be used for breeding, so I wouldn't like that situation. And if the 8 years old dog has like a 7 calcifications, then we know it's not a very good back with the dog, because not like these non-chondrodystrophic dogs which are 7 years old, they don't have calcifications in the back. So it tells something about the old dog also. So.
But I think it's because we have a tradition have done that for 15 years now, so we don't have old dogs that are not.
Yes, exactly. Yes. We have talked this with the IVDD, and she explained us the situation in Denmark is different because you have had the system for so long that you're used to it, and you don't have the old ones that are not imaged, but we still have it. And of course we don't know that for sure, because if it's in dachshunds, the age limit, it's in 4 years, but I'm not sure it would be in Skye Terriers, for example, because the age that they have this disease is little bit different between the breeds. For example, Basset Hound, it's older. It's about like 7-8 years that they get this disease. French Bulldogs are like 3 years when they get this disease. Dachshunds are like between 5 or 6 in average. So it's different. So I'm not sure that the calcifications and the degeneration is totally same even between the different chondrodystrophic breeds. So that's why not like a strict like a. So, but this is the evaluation. But if the dog has 5 calcified discs, then I could, and it's a chondrodystrophic dog, I would suspect in the MRI that it has quite severe degeneration in the IVDs in total, and I wouldn't like recommend that kind of dog in breeding. At least you have to be aware of the situation, but I think it can be like in different breeds like use that you at least know what the breed average is, and you take the better ones for breeding, not the worst. And here I have some images that I can show you the calcified IVDs also. Here is again very small calcification in IVD, and here is a bigger in the thoracic spine. And of course here is this rib is summating here, but here below I can see the calcification in the image. And then of course when we look at these images, we have the good screens and we have dark room, and we can like a little bit do the scaling of the grayscaling in the images, and we can look it in the different ways, that because these are not always so easily detected. Here is another calcification, and here is again calcification. And of course you have to know the anatomy to know what are the normal structures that may be some mating here, and what are the calcifications. And then here is again, here we can see, and here we can see calcification. But in radiographs, if it would be a clinical suspicion, it would be very difficult to say that if here in the area of the spinal cord would be something. So that's why we would need the MRI for that. Here is also one calcification here between the cervical and thoracic spine, and then I can do also this inversion of the image when I look at it and be more sure that it's calcified IVD material there. And then some of these chondrodystrophic dogs have spondylosis. Here it's in the end of the lumbar spine, and usually within the chondrodystrophic dogs, the spondylosis is because of the intervertebral disease. If it's like a long-legged dog, not chondrodystrophic, they have other reasons for spondylosis, but these chondrodystrophic dogs have usually spondylosis because of this disease. And here actually in this dog we can see when I invert this image that there are calcified disc material still left here in this space. Some of it might have like a subclinically, maybe without the symptoms, extruded from the IVD space, and here is the spondylosis because the IVD space has collapsed, and it has to have some way to like stabilize the situation, and that's why the dog has a problem. thrown the spondylosis to stabilize this situation. Yeah, exactly. Here are some also in the Dallas space. There are normal and inverted image, and here we can see this calcification, so the generation between sacrum and the tail, and that's what I was willing to say also, because I had some clinical patient that was consulted by, and then I found some reports about the IVD like extrusions in the tail area. So if the dog has a problem, like it's like the tail is suddenly like in pain or like dropping down like and that was a poodle, and they have this gene also. And then it went to neurologist when I was suspecting that it might be because of the IVD disease, and they could make it the diagnosis with the MRI also. So that's something to keep in mind. So what's the relevance of these calcified discs? It has been studied very much in dachshunds, and in that breed, at least the increasing number of these calcified discs increases the risk for clinical disease. There was this Danish study, IVDD was only Jensen at that time, and she could prove in her study that the dogs that had 9 calcification had 88% risk for developing during the follow-up time the IVD disease, the clinical disease, and the risk was between 5 and 8 calcification is 63%, and with 2 it was 11, and with the 0 the risk was 8%. So if the dog doesn't have in radiographs any calcification, it doesn't like make the risk 0, and some it's more rare, but some of these may still have quite many calcifications, but they are so small that we cannot see them. But usually we see them, and the risk is bigger, really bigger with the ones that have more calcifications. But there are rare cases that are like a 0 and still they get problems. And there are clinical studies which have been done in several breeds, that if the dog has several calcified discs, it increases the recurrence rate. So if the dog is operated, it has several calcifications, then it gets extrusion in another place during the life. About the radiographic screening in Finland, so it's mandatory for some breeds. So for dachshunds, corgis, and French bulldogs at least, I think we have this Nordic IVD panel with we have just Finland and Danish representatives, because Anu Lappalainen from Finland is scrutinizing in Sweden also, and IVDD from Denmark is scrutinizing Denmark and Norway, and I'm only in Finland. And the Swiss people have also started scrutinizing the IVDs recently, and they are together with the negotiations with us, and I think they use the same system that we have in the Nordic countries. In dachshunds, the number of calcified discs have proven to have high heritabilities. So there is of course this major CDD gene, but still in our study and some other studies also have seen these differences, and we saw the differences in MRI between these dachshunds that had all these genes inherited from both parents. So there are differences that this gene doesn't explain totally, even it explains very much about this disease. So those smaller genetic things that affect this disease, we want to resist them with the screening. So when the allelic frequency of this gene is very high, we have to use this radiographic screening to resist this disease, because we cannot exclude them all from breeding. And it's possible to get results when we use the results in breeding decisions. If you just screen and don't use them, the results, we don't go forward. Kirsi gave me these nice photos. Do you have any questions? Yeah.
We had a dog that we had sudden onset loss of back legs, older dog girl, 8. We didn't go down the surgery route, but he had we think that he jumped up and fell on his back. But now, how long has it been? About 12 months? Yeah, and he's come right back. So is it possible if they have calcification and then they have an injury that can cause pressure on the spine that can recover? Because that seems to be what's happened.
Yeah, they can, and of course, usually when it's not only calcified disc spaces that they will have the extrusion, because the calcified discs are they are like an indicator that there are degenerated IVDs around the spine. Usually many of the IVDs of these dogs are degenerated, if there is calcification or not, and the more calcification there are, the more degenerated IVDs there is. And it might be that it has been a calcified material or some other degenerated material that has been extruded, but some of these extrusions are subclinical. So the dog, when the dog has symptoms, it's not unusual that when it goes to MRI, usually the neurologist knows what the IVD space is, what causes the symptoms, and that's why we know what is the place. But there might be several places that there have been older extrusions that the dog has just compensated during time and not causing the severe problems. But some of them, and conservatively, they have just recovered. But some extrusions are worse than the other, and some then cause the total paralysis.
Yeah.
Then I think that it's quite sure that the chromosome 12 Redder gene cannot explain everything, because there are so many dogs that are homozygote for the mutation and still they never develop any disease, and then there are dogs that have one copy and they might get the disease, or then there are those that don't have anything. So I think that there is and as you said, that there are breed specific differences. So there has to be also other factors, like polygenic factors that are affecting the situation. So that it's not black and white. And we have to remember that if the dogs have this mutation in the chromosome 12, they are prone to this disease. But it doesn't tell that they would be getting the disease. So that there has to be more research done also on the genetics. And I think that we get the genetics when we get the breed-specific differences.
Is there an index you could have between the different breeds? So you have the index between NN and little n and big N. What is the index between the different gene?
But the USDA is collecting these these test results, and already from there, from the list of the breeds that they have there, you can already tell that there are some breeds that are having this problem, and then there are some breeds, and then there are some breeds that don't have that problem. At least they don't have that much. But we have had Skye Terriers with the problem.
Yes.
We have had, so that you cannot say that we wouldn't have any problem. We have had dogs that have paralyzed, and we have had dogs that have had symptoms.
Yes.
And when we are asking about this, we have a veterinary clinic in here quite close to Helsinki, there are specialists for these neurological disorders. And when we have asked them, do you have any patients like Skye Terriers? Yes, we do.
Mm-hmm.
But
So
people are not so open about this anymore.
That's what I was saying.
Yeah.
We really need to be honest.
Yeah, and it's not so always so easy to use. The dog doesn't want to walk, it's not lazy, or
It's not so clear that they have.
there's something to do with the
Yeah.
mind if it's
Yeah.
irritated, but it might be pain.
Yeah. And if they are paralyzed, then even an idiot can see that they cannot walk. But they might have not so severe symptoms.
Yeah.
And then, for instance, jumping to the back seat of the car or something like that, they are not willing to do that.
Yeah.
They might then also have problems with the hips.
You have to find out what's
So
the
you have to
problem.
find out what it is.
And when you have bred for many years and people tell me I don't have any problems, then I know for a fact you're a big liar.
Yeah.
Sorry to say.
It is true.
So I think it's important to tell the truth and speak about it, because I don't hit people on the head because they have problems. On the contrary, I say, oh, I'm so sorry, I know how it is, and our heart bleeds for the breed, so.
And this also, this disease, it's costly when it hits you.
Yeah.
Because then you have to have, if you want to save the dog, you have to have these MRIs, and you have to have the surgeries and everything, and then it takes ages to recover, if they recover. So it is costly. It would be much more it would be easier if we could avoid it before it hits you.
And often, or not often, but we sell our puppies to family with children.
It's terrible.
It is.
Stress and
Yes,
this
yes.
loss.
And to have them in your phone and they find their heart out, it's not
I had also one image that's in Finnish because I took it from my other lecture about this incongruency. There are different stages. So this is the image that we need for the evaluation. So it needs to be in neutral position to evaluate the incongruency. So it's when the normal elbow displacement is taken like this is taken like this. So it's 90 degrees open the elbow, and here is a normal chondrodysplastic dog with no incongruency. Also the wrist is quite nice here, but this is a grade 1. Here we can already see that the wrist is this dog is also a little bit turning, but there is a little space between the humerus and ulna here, and the step between radius and ulna in the elbow. And this is the grade 2, that we have a bigger step here between these bones of the elbow, and the wrist is turned here also. And here is a grade 3, that this is clearly more like a deformed elbow. And there is some new bone formation representing osteoarthritis, and the space is bigger and clear here, and many of these have also this new bone formation here near the throat blade of the distal ulna, and there is this also here like a little turn in this.
And that's too wrong. And I said, I mean, he was diagnosed when we started this study, because we didn't have any tools to study it before, and he had not been limping. So I thought that I'm taking all my dogs to this study, and then there were these like couple of nice ones, and then kind of not so nice ones. But that's cool. Yeah.
I think it was really nice cooperation at that time because all breeders come together and we sent there a lot of dogs in that one time.
It's very nice. I
Question
think
for the Finnish breeders. It's the Terrier dogs are more effective with the stronger dogs, or
I think so.
because if you see
I think
pictures,
so.
with the stronger bones you have.
I think so,
Yeah.
yes.
But these are different breeds.
Yes.
These are, I don't know actually which breeds these are. These are different breeds. I just
Yeah.
selected.
Yes,
Yes, but
I have never
think that
seen a
you are
Skye
right.
like.
Yes,
Yeah.
you look at the
Yes.
picture.
Yes, from my experiences, I know that when I had these heavy bone males, both of them were diagnosed as grade 3, both of them. And then these bitches that I had that were not so robust and not so heavily built, they got even this in this first study that we had, a few of them got grade 0. So I think that we have to pay attention also to the size of the dogs.
Yes.
So yes, that's a big bugbear for us because Australia we have a height standard 10 inches. 10-inch dog is like half of the size of the dogs that you see here overseas. So it's hard having two standards.
Yeah.
Yeah.
So the size is something that we should be looking also at, because I mean we can get like more problems with the heavy bones. Heavy bones.
But the problem is I find that the judges seem to like the bigger dogs.
Exactly.
Yes, I mean, but
Yes,
it's
yeah.
almost in every breed except for duckhorns, because they have varieties.
Yes.
You have to the different varieties. But
It's a
I
shame.
mean, it is true.
Many
It's because
times
they
nails
look
are
more fleshy.
Yes, exactly.